Thank you so much for inviting me, Mandy. I'm glad to be here. I've been a primary care doctor for a while, over 30 years, but I will say I've spent a lot of my time as a doctor thinking about how to make the interaction between patient and healthcare provider better, how communication can be better, how it can be a two-way street, how both sides can listen effectively, ask the right questions, do it in a very organized fashion, so you get to the root of the problem. You get the confidence of the patient. They hear you. They follow your directions. They ask the questions that need to be asked, and all of that within the standard 7-minute visit, which is what in some circles we're told to keep it to. But I'd like to talk tonight in a way that there's really no time limit imposed on patient and healthcare provider, so that you can really get a sense for the interaction and how to make it work well. The way I outlined the information for tonight is first to talk about the types of visits, probably something a lot of people don't think about, but what is the nature of the visit? Because based on the nature of the visit, the way it's set up, the way you think about it, helps you figure out what your ultimate goals of the visit and your expectations of the visit are going to be. And key to that is really how you provide information to the physician, to the healthcare provider, some of which will be prompted, some of which will be questions directly, but other ways it flows is more free flowing. You're going to provide the information. First step is really types of office visits. And the way I think about office visits is three kinds. One is your annual, your yearly, your well checkup, your annual physical, whatever you want to call it. But it's basically prearranged. It's not based on any new illness, new concern, but it's a once a year checkup. And I really look at that as a way to not only see where people are, but where they need to be in their healthcare journey. But it takes a lot of preparation to really get a lot out of it, both the physician to get a lot out of it and for the patient to get a lot out of it. So we'll talk about how I structure it, and hopefully some of the points I make are things that you'll be able to use when you see your healthcare provider. A routine follow-up visit is the doc says, I want to see you back in 3-4 months to check X or Y. That's a routine follow-up. And then the final is the sick visit, the urgent visit. And that's something out of the blue comes up, an urgent need to come in. And all of those are actually approached a little differently, or at least I approach them a little differently. Let's start with the annual visit. And the way I view that, it's a review of all of your health issues, especially ones that are active, ongoing, not where you can put them in the past history column, but in any way they're still relevant. And for a lot of that, the healthcare provider will drive the conversation. How is your diabetes? How is your hypertension? How does your back feel? But I think it's really very helpful for you to come with your own list of issues that you feel are still active, because a lot of healthcare providers, after they've seen you and provided you with recommendations, in their mind, they may or may not think those are no longer on the table. But it's helpful for you to make a list of just 1 through whatever, of all the things that you see as active health issues, be them large or small. And be prepared to also talk about any new symptoms that have recently come up. This is not just to talk about old stuff, but anything new. And a lot of times, and Dr. Ritchie will be aware of this, because we talk about this review of systems. What that is a way of asking you about each of the body's systems: urinary, bowel, stomach, heart, lung, etc. And that's often done during this annual visit, where we'll just say, we've talked about everything. I get it. I know where you're coming from. I hear where you stand with your issues, but let me just make sure we're not missing anything. And that's the point of the review of systems, because you may assume it's normal. You may assume it's normal for you. But when we say, how many times do you get up to urinate at night? And you say 17 times, we may say that doesn't sound right. And maybe we should explore it and add it to the active list. Really very, very, very important, because a lot of mistakes can be made in the next line, and that's be prepared to have a list of all your medications. And that includes, really important to include, all your supplements, all of your vitamins, anything that you take that's in any way medicinal. Why? Because they can interact in so many ways with the medicines we prescribe. And you may not think that taking X or Y would have any significant impact, but it's important to bring that up. And it's not only the list of medicines, it's really helpful to include the dose and how often you take the pill. And the reason for that is to make sure that your list agrees with our list, because we're going to make changes based on our list, but really we should be making changes based on your list. So they really do have to agree. And during an annual physical and actually during the routine follow-up, it's a good time to say, you know what, I looked at my pill bottles and I saw that I'm on my last refill. And while I'm on that page on the computer, it's easy enough to renew the medicine. And why that helps is it saves you a phone call or a future reach out in between. So it's just a good time. You've looked at your medicines, you've confirmed with your healthcare provider that your list is correct. And by the way, you know, doc, I do need that one refilled while I'm here. Sure, happy to do it. And the next part on the screen, same with your allergies. Really important for your healthcare providers to be fully aware of your allergies. Medicines especially, but if you've had reactions to foods, to environmental agents, to anything else, it's really important to bring that up, and not only to list it, but be able, if you can, to talk about what the actual reaction was. Because a lot of people will say, I'm allergic to penicillin. And when you delve down into it a little bit, well, they took penicillin and their stomach got upset, or they took penicillin and they had anaphylaxis and their throat closed. So those have obviously a lot of different implications. So it's not only what you can take, but what was the reaction, because it alerts your healthcare provider to be aware not to prescribe it, or even to prescribe in a serious reaction anything that may be even closely linked to that agent. So some other things during the annual visit that I like to spend a lot of time on, because it really helps me understand what are the aspects of my patient's lifestyle, their investment in their health. You need to ask the question. So under habits, I always want to know about diet, exercise, smoking. I always include sleep and rest. I'm a big believer that how much sleep you get, how well you sleep, how well rested you are, impacts a lot of body functions, memory, alertness, how well you can think during the day. So I usually want to hear from people how their sleep is. And I think if your sleep is anything other than perfect, it's something you really ought to mention to your healthcare team, because there are a lot of ways that you can impact sleep, not only with medications, but in so many other ways. A question we're always told to ask is, do you feel safe? Is anybody threatening you at home or outside the home? It's actually a state mandate that we ask. It's a good time to bring up any barriers to care or resources you may need. How can you get medications more affordable? There are ways. A lot of healthcare providers have resources available to them. But if we're not aware of any barriers to your meeting your healthcare goals, and we're not able to help you in those, then it's harder for us to get you to a healthier point. I always like to ask people about changes in life and work. You've had a grandchild, you've changed jobs, you're out of work. Very important, because those things impact your physical health. They impact your sleep, they impact your energy, they impact your focus, they impact your ability to stay on task in terms of keeping your health at its best. So it's really something that you want to be prepared to mention to the team at your annual visit. Next part is unbelievably important in my mind, and that is the family history. And a lot of times we move through that really quickly, but it's the key to, in a way, understanding what your ultimate risks in life are. So if you've got a family history where your mother had breast cancer, your mother's mother had breast cancer, your mother's sister had breast cancer, it's almost certain there's a genetic component there. And if we're unaware that that history exists, we may ask for routine screening. We may even not pester you to get your yearly mammogram quite as vigorously. But if we knew that there was a family history of diabetes, heart disease, cancer, it makes us think differently about how your ultimate health risks are in life. And I can't stress how important that is. And it's not only what disease runs in the family, but also the age of onset, because the earlier the age of onset of a disease, the more likely there is to be a genetic component. So if your mother had breast cancer at 38, I would be very concerned that there's a genetic component. And then there's certain cancers that run with other cancers in family, ovarian, breast, colon cancer, pancreatic cancer, that do help identify other genetic causes that can be tested for now. And if you have that gene, then we change the way we screen and watch you. And we can actually save your life in that regard by being more attentive to what your potential health risks are. Also at the annual visit, I like to think of that as a way to look through all the screening tests that are routinely recommended. Mammogram, pap smear, PSA, colon cancer screening, cholesterol, sugar, whatever it may be. And of course, in my mind, I tailor that again to what personal risks are, family history risks are, what you've had before. But it's a good time for me to do the checklist of all the things that should be done. And if they're not done, to actually schedule them right then and there to make sure that those things are kept on track. It's also the time when I like to update all the vaccines. I listed all of them that you may be familiar with. There are a lot of other ones, but be prepared to come prepared, I should say, if you've had vaccines outside of your healthcare provider's office. If you can bring that information, we update our records because not all vaccines show up in your file. And if you wind up, you're on vacation, you fall and scrape yourself, go to urgent care and get a tetanus shot, it's unlikely that tetanus shot is going to show up in your health record at our office. So bring it in, let us know, we'll update the record, and that way we'll make sure that you stay on track for the every 5 or 10 years or whatever it is you need for the vaccines.
How, as a patient, am I supposed to know how often I need these screening tests done? And what does that look like, to unfold that a little bit?
Yeah, so great question, Mandy. So the tables that we as healthcare providers look at for how often these are done are complicated, often changing, and they are very much influenced by some of the other factors I mentioned, like your genetics, your family history, what you've had before. So one question you could ask is, at your visit, what screening tests, if it hasn't been brought up, what screening tests should I be looking at? But in general, it's tests for cancer. I've listed those: the mammogram, the pap, colon cancer screening, diabetes check, cholesterol check. We'll put blood pressure on, but that's really part of the exam. It's hard for the patient to keep track of it. It's quite frankly my job to keep track, but it's certainly reasonable for someone to say, am I due for any of my screening tests? Because if I haven't gone through it in detail, it makes me go through my list and look and see when the last one was done, when the next one is done. But for instance, colon cancer screening can be every year, every 3 years, every 5 years, every 10 years, or after the age of 75, they tell us, for most people, no need to continue to check. On the other hand, if someone's already had a colon polyp, for instance, and we say you don't get a colon cancer screening every 10 years now, you get a colonoscopy every 5 years because you've had a polyp. Well, that's something you make note of, because you're going to come back to that. And it's not uncommon for someone to say, when was my last colonoscopy? Because I had a polyp. When should I be doing it next? Well, it's my job to keep track of that. The end of visit summary, I know with our system at the Brigham, we can provide what they call an end of visit summary, which is a paper that records all of those things. I like to make sure mine's very detailed, because I understand that when you're there, you may be anxious, you may be nervous, you may be thinking, Dr. Bass just talked my ear off and I'm late for work, and you stop listening. But I've got to put it on paper for you and provide it for you, either right then and there, send it to you later by Patient Gateway, which is what we use at the Brigham, or I send it to people by email if it's something they want that way. But if you leave there without having something in writing that lists all those things, you're going to forget 1, 2, 3. I know I would forget most of them when I leave my doctor's visit. And then I am very careful that when someone leaves, I outline for them when I want to see them next. I find that if I don't make the follow-up visit right then and there, and people say, well, I'll get back to you, or they leave inadvertently before the follow-up appointment is made, that almost certainly they'll come later than they should for the next visit. So if it's not clear at the end of the visit when the healthcare provider wants to see you next, ask, when do you want to see me back, and make the appointment.
There is a question in the chat from Mildred, and she wanted to ask a little bit more about the colon cancer screening that you had mentioned. And you had mentioned discontinuing it sometimes. So her question was, at what time is it typically discontinued, the colon cancer screening?
No, great. For general screening, we usually stop at 75. Usually, if you've had colon polyps that appear with regularity on your colon cancer screening, and your health is pretty decent over the age of 75, I'd actually argue we push that up to 80, because if you're pretty vigorous, pretty healthy at 75, there's a decent chance you're going to live into your 90s. Well, we don't want you to develop any colon cancer on top of a colon polyp by simply following a firm guideline, 75, you're done. It's not the case. And by the way, for people who get to be older and over 75, maybe a little more frail, maybe a little more hesitant to do colon cancer screening, there's non-colonoscopy ways to screen. There's stool-based tests that can be done that don't involve the higher risk of a colonoscopy, which isn't very high risk, but as you get older, it's a little more challenging. The preparation is challenging, the anesthesia is challenging, the test is less than pleasant. Routine follow-up visits, that's easy. That's really what was the discussion at the end of the annual physical or the last visit, the active problems. And the important thing when you show up there is to come prepared to say a couple of things. One is what you notice different in that regard from the last visit. So for instance, you were in and during your annual checkup, you mentioned your knees hurt, and the healthcare provider said, well, I want you to put ice on your knees. I want you to do certain exercises that involve strengthening your quads. I want you to see a physical therapist. I want you to take some Tylenol. I want you to put some Bengay, over-the-counter Voltaren gel, whatever it is. So when you come in, what we as healthcare providers really want to know is, well, what's happened when you did that? That's the bottom line. What's different? And that's not only based on the medications you took, but everything you did that may have been different. Well, you know what, doc? I started sleeping on my side with a pillow between my knees, and my knees stopped hurting. All right, I want to know that. Not only do I need to know that because it's helpful to know it was that easy a cure, but more importantly, it gives you some idea of what the triggering mechanism is, what we may have to do in the future if it recurs. You may not remember, but if my notes say, yeah, you put a pillow between and it worked. So anything that you've done differently that's had an effect on those symptoms, you want to be prepared to report. And by the way, that's not only positive things, but it's negative things. You know what? My knees hurt. I did those exercises you told me, and my knees hurt more. Okay, I learned my lesson. Let's change the strategy a little bit. But it's not only what makes them better, those symptoms, what made them worse. We need to change our strategy. We need to change how we go about things. The sick visit or the urgent visit, this is actually approached a lot differently. And this is where knowing what the questions are going to be and thinking about things in advance can make the visit that much more educational for you and for the physician. You can really get to a problem that much better. You'll really have your healthcare team focused in better on what's troubling you. So a sick visit is problem focused. Any of the problems which we've already mentioned, your back, your knees hurt, your belly hurts. And the questions you're going to be asked are, how long has it been going on? And if you come in and your belly hurts and you don't think about these things, you may not be as able to be accurate, but how long things go on and whether they come on suddenly or gradually, or the next one, things that make it better or worse. These are things that actually tell your physician what the problem is. Being clear on the nature of your symptoms really helps the physician narrow down on the diagnosis and not wait for the blood test, the CAT scan, or the MRI. So how long has it been going on? Was it sudden or gradual? What things make it better? Well, I have belly pain, but every time I move my bowels, I feel better. What makes it worse? Well, my back hurts, but every time I cough or sneeze, I get a pain down my leg. These are vitally important clues to what's going on. Treatments that you tried at home. So your belly hurt, you put a heating pad on, you took a laxative, you took some Advil, whatever you did that created some benefit or made it worse, we need to know. And anything physical you noticed. With belly pain, what are the bowels doing? What's your bladder doing? With back pain, does it hurt when you walk or does it feel better when you walk? So these are all things you wouldn't necessarily think are relevant or important, but they're actually crucial for us to be good at what we do and to help you. So I want to talk a little bit about tricky issues. Tricky for patients, tricky for doctors. And a lot of times people come into the best of our ability. The diagnosis remains unclear. The symptoms are there. I know your belly hurts. I can't give you an answer. I can't figure it out yet, but I hear you. Let's keep working. I may want to get a consultant to take a look at you. It is sometimes frustrating for patients when they've had 2, 3, or 4 visits and still haven't gotten an answer. It becomes frustrating for a healthcare provider sometimes. And quite frankly, I find it helpful to sometimes say, this is a bit frustrating for me. I can only imagine it's frustrating for you, but let's figure out a way where we can get to the answer. And if you're frustrated by that, it's okay to bring that up to your physician. Doc, it's been going on for 6 weeks. I'm getting a little frustrated. Who wouldn't? And we certainly don't blame you. If you have that frustration, it helps to be able to bring that to the public forum so that it doesn't just brew underneath it all. Because at the end of the day, the relationship with your healthcare provider is about trust and confidence. And if you don't have that trust, you don't have that confidence, it's not going to be a real healthy relationship. Second opinions, Dr. Ritchie, myself, we're always taught to say in a smiley face, oh, a second opinion, no problem. Happy to do it for you. Happy to get you that. In reality, it's always a little bit tricky. It's always a little bit challenging, reaching out to some other people who are more expert, sometimes hard to get to. But that goes along with the first line. You're getting frustrated. You want a second opinion. I'm there to honor that. That doesn't mean I stop caring for you. That doesn't mean I stop trying to figure it out. It means I try and line up that second opinion while I keep trying to go down my diagnostic pathways to figure it out.
It is the patient's choice. Like they have kind of, the autonomy to disagree with whatever my guidance would be. And that's totally fine. And I totally get it. But I, will sometimes say, I usually like to say, like, this is probably what I think is like the best option. And there are maybe other options, especially if, I know the patient really well and I know what their preferences usually are and certain types of, like, if they are someone who, really wants to avoid medications at all costs, or someone who really likes or is okay with taking medications. Nobody likes taking medications, but so I try to kind of align it with like what I know about the patient's preferences, and then also, again, what I think I would do for my family, but always kind of, let them know that there might be other options, and that if they feel very strongly about a different option, then I'm here to support that. So
As long as it won't lead to them doing less well.
exactly. Yeah.
But if anybody has thoughts, hypotheticals, again, not to talk about specifics of any illness, but if you've come across any of these issues with the physician, if you have any thoughts, questions, feel free.
I actually, I'm not sure if it's a question, but I think what both of you were just saying about really having a good relationship with the patient is the basis. And then you can say, this is what I would do for my family, or this is what I recommend. Because as Dr. Ricci said, some people might not want to take any medications at all costs. And Jeff, I've heard you on the phone. I've heard the other end, only one end of the conversation, where you come up with a plan that is actually best for that person, or what that person wants to do, to give it a try. So it's not, I know what you mean by saying, this is what I would do for my family. And I've heard you say that too, but you're very patient focused before you're just, this is what I recommend.
Absolutely correct.
I always wonder how much the doctors get involved with things like insurance, co-payments, and what those processes look like. So one year, a while back, one of my children, who shall remain nameless, broke her foot. I, by the way, have 2 sons and 1 daughter, so you could probably figure out which child it was, but she broke her foot and it wasn't healing well. And the doctor said, I'm going to send you home with this. It was some kind of a bone stimulator, something bizarre. And I just said, okay. And we took it home. And then the co-payment on it was like $1,200. And it had never occurred to me in the visit to ask, how much is the co-payment for this? And obviously I figured it out, but I thought, geez, what if someone else, their little kid breaks their foot and this doctor says, just go do this. And this is something that really like breaks the bank for this family. How much do doctors sort of think about a process like that?
It's a hard question because there are so many factors that go into it, because every insurance plan is different. It's a joke. It's intentionally deceptive, I believe. It's intentionally deceptive so that for whatever reason, the health insurance companies, they want to make it so opaque and so difficult to see through, because if it were clear as could be, there'd be a lot more unhappiness out there, because we'd really see how so much of the cost, the burden of care falls on the individual.
Keeping a journal of basically the things that happen to us during the course of our day, especially exposures to certain things, falls, things like that. So if it ever gets to a point that we cannot speak for ourselves, they can look at this journal and get an idea of what occurred. Thank you very much. Also, Dr. Bass, for taking that question of mine.
Absolutely. Making notes of things for the visits or for family members to accompany you during a visit, really helpful. Absolutely.
Another thing kind of off of that too, that I will say is, God forbid there's a situation where you're not able to speak for yourself. another thing that I talk to my patients about, even, at a young age, is talking to their family members about, God forbid anything were to happen to them. What are medical procedures? What are things that they would be okay with? And again, it's a little morbid to think about, but God forbid something were to happen and you can't speak for yourself. It's important for your family members to know, oh, she would never want to live a life where she could not do this, or he would never want to live a life where he could not do this. Again, a little morbid, but it's really, really important for family members to know that. So that just made me think of that.
Absolutely. We, as physicians, I don't think we think a lot about the patients having preconceived, thought out notions of that, but they always do.
Yep.
Patients know what they want in different situations.
Yep.
It's their job to ask.
I want to thank both Dr. Ricci for helping us tonight and Jeff for speaking and going over these appointments. Thank you.
Well, thank you for having me.
Thanks. So much fun.